Welcome back to Apparently. This is Dr. Mark Boyd. Today we're going to talk about an abnormal glucose tolerance test or an abnormal screening test. Now, if you get that dreaded call from your doctor's office that your glucose screening test was abnormal, don't freak out. 1 out of 3 women have abnormal values. They have to go to the next step. This is the diagnostic step to determine whether you as a patient have gestational diabetes. Every office is a little bit different. Some will do what's called a 2-hour glucose tolerance test. Some will do what's called a 3-hour glucose tolerance test. It's the same type of test, but it gives you a little bit different values. Now, important to understand, both tests require you to be NPO. That means nothing to eat or drink except water for 8 hours prior to the test. When you show up for your test, you're going to get a defined amount of glucola. If you do the 2-hour test, you're going to get 75 grams of glucola. Again, this is the same sweet tasting pop that you drank for your screening test. Or if they do the 3-hour test, you're going to get 100 grams of glucola. Now in the 75 grams, before you drink that, you're going to have what's called a fasting blood sugar drawn. So they will draw your blood before you drink the glucola, and then they will draw blood at the 1-hour mark and at the 2-hour mark. On the 3-hour test, you're going to again have a fasting blood sugar drawn, and then you're going to have a 1-hour drawn, a 2-hour drawn, and a 3-hour drawn. After you complete your 2-hour and your 3-hour glucose tolerance test, your office will notify you usually within a week if you are normal based on these values or abnormal based on these values. If you have gestational diabetes, so the values come back showing that you fall into the category of being abnormal and now you're defined as a gestational diabetic, what is next? Well, at that point, you will be referred to a maternal fetal medicine specialist or a perinatologist. You will be followed with high-risk testing, high-risk ultrasound evaluation, and you will see a nutritionist at that point. Most women that have gestational diabetes do not end up on insulin. They simply can manage their gestational diabetes with diet or an oral agent. That's good. However, if you're one of the patients that has to go on insulin, it's not fun, but it's very important for the health of your baby. I encourage you to follow these regimens closely. I hope this was helpful today. Have a great day.